Hello everyone, welcome to Jessie's MedBio. In today's section, we are going to discuss about three topics, that is agencies related to welfare services to the children, internationally accepted rights of child, and changing trends in hospital care, preventive, promotive, and curative aspect of the child. So first I am going to discuss about the agencies. Here we can able to see two agencies, that is National Agency and International Agency. Under the National Agency, four agencies are there. First one is Indian Council for Child Welfare. Second one is All India Women's Conference. Third one is Indian Red Cross Society. And fourth one is Central Social Welfare Board. Then under the international agencies, first one is World Health Organization, second one is United Nations International Children's Emergency Fund, Food and Agricultural Organization, and last one is International Red Cross. Today I am going to explain about the national agencies. So the first one is Indian Council for Child Welfare, which was established in 1952. The main aim is to promote the welfare and development of the children, and the major functions which is coming under this agency is to initiate and undertake services for child welfare and development, which means they are responsible to providing certain type of services for the child welfare like health, nutrition, education and all. Then also they are responsible for the establishment of certain type of legislation or policies which is benefit to the child. Then they are started the Balwadis, crèches and early childhood education centers all over India. Balwadi means it is the Anganwadi or the preschool. Then crèches means it is the daycare centers. This agency start all these things for the development of the child. Then also they provide integrated services in health, nutrition, non-formal education, recreation and social development of children. These are the major functions which is coming under this agency. India Women's Conference. It was established in 1927. The main aim is to improve the status of women and children. The major functions are works for the upliftment and betterment of women and children, promote social justice, integrity, equal rights and opportunities, engages in education, health, vocational training and legal awareness, works for the protection of women and children from exploitation and abuse. Here they are mainly focusing on providing all the services which will benefit to the children and the women, and also they are protecting the women and the children from the abuse also. Fourth one is the Central Social Welfare Board. It was established in 1953. It is a semi-government and autonomous organization, which means half government and half non-government agency. The main aim is to promote social welfare through the voluntary organization, which means they are supporting the voluntary organizations to help the children and to provide the grants and all. The major functions are promote and support voluntary welfare organization working for children, then provides grant in aid to voluntary organization for child welfare activities, then conducting surveys, research and training, then coordinating and guiding child welfare agencies. These are about the national agencies. The second one is United Nations International Children's Emergency Fund, that is UNICEF. It is a specialized agency which was established on 11th December 1946. The main aim is to provide emergency health care and food to children in the countries affected by the World War II. So this agency was developed after the World War II, and they are mainly focusing on providing healthy care and food to the children, those who are affected by the World War. Then after that in 1953 it was renamed as United Nations Children's Fund. The headquarters is in New York, USA. The next one is right to enjoy these rights regardless of race, color, religion, nation and social origin. which means every child has the right to enjoy all the above rights without the discrimination based on the gender or race, color, their language, religion, and all. These are about the rights of the children. Then our last topic is changing trends. Here also 10 points are coming. So the first one is family centered care. This I already explained in the previous classes. Family centered care means the healthcare members are involving the parents and family members to be in the part of providing care to the children. Then high technology care. High technology care means nowadays they are using the advanced medical equipment and technologies for the diagnosis and treatment. So they can able to detect the disease condition earlier, and also they can able to provide the treatment properly. Then third one is evidence-based practice, which means nowadays the nursing care is based on the latest research, and also it is given by clinical expertises, and according to the patient needs they are providing the care. So by giving evidence-based care, we can able to ensure that a safe, effective and quality care is provided. Then next one is right to be among the first to receive relief at the time of disaster, which means during the emergency time or during disaster time, the children should receive proper food, shelter, medical care properly. Then right to learn to be a useful member of society and develop individual abilities, which means the children should receive education and guidance that help them to develop their talent, skill, confidence, and also the responsibility. Thus, the child can be able to be a useful member of the society. Then, right to be brought up in the spirit of understanding, tolerance, peace, and universal brotherhood, which means we have to taught the child to respect others and how to live peacefully and avoid the discrimination, and also we have to promote the friendship among all the people. So next one is right to name and nationality, which means after the birth every child has to be get registered, and also each child should have the right to get a legal name, that is right to name and nationality. Then the sixth one is right to special care if handicapped, which means if a child is having any physical, mental or developmental disabilities, he or she should have the right to get the special care or special attention. Our second topic is internationally accepted rights of child. Under this, around 10 rights are coming. It is also an important topic for our examination. So the first right is our second topic is internationally accepted rights of child. Under this, around 10 rights are coming. So it is one of the important topic. So the first right is right to affection, love and understanding, which means every child has the right to be loved or to be respected and also to be brought up. So our second topic is internationally accepted rights of child. Under this, around 10 rights are coming. So each one. Our second topic is internationally accepted rights of child. Under this, around 10 rights are coming. So the first one is right to affection, love and understanding, which means every child has the right to be loved and to be respected in the society. Then right to enjoy social security, nutrition, housing and medical care, which means every child should have the access to proper food or safe shelter, health care and also the social welfare services. Then right to free education, which means every child has the right to get free primary education so that they can able to improve their knowledge, skills and all. Then right to full opportunity for play and recreation, which means each child should get enough time and opportunity to play and also to participate in sports activities, then other recreational activities and all. So the fourth one is primary nursing. Primary nursing means a nurse should be available for all the time in providing the care. Then next one is case management. Case management means the nurse should coordinate the healthcare services from the admission time to the discharge time. Then child oriented environment, which means the hospital environment should be made according to the child interest, or it should be child friendly. Thus we can able to reduce the fear and anxiety among the children. Then atraumatic care, that I already explained in previous classes, which means we are providing the care that minimizes both the physical and psychological stress of the child. Then cost containment. Cost containment means we have to provide high quality care, but it should be affordable to the family members also. Then nursing process application, which means we have to follow the systematic method of providing nursing care, which means assessment, then diagnosis, then planning, implementation and evaluation. Like that, in a systematic method, the nursing process or the nursing care should given. Then last one is ethics in pediatric nursing. Ethics in pediatric nursing means we have to provide the care according to the ethical principles, which means we have to respect the child's right, then we have to maintain the confidentiality and also the informed consent, then all the other principles like justice, beneficence, non-maleficence. By following all these principles, we have to provide proper care to the child. These are about the changing trends of child care. These are the major three topics we have discussed today.